The measles, the most contagious virus known to mankind. And we're talking about it a lot these days. In this video, I'm going to discuss exactly what the measles is, how it presents, what the treatment options are, and why everybody is so concerned. Children are exquisitely sensitive to measles infections. 20% will require hospitalization, and unfortunately, 1 in 1,000 will die from the disease. Many people confuse the German measles with the measles, but they are not the same. They're two distinct diseases by two different viruses. The measles, known as Rubiola, is from a morbillo virus. The German measles is rubella. Both are covered in the MMR vaccination, the measles, mumps, and rubella vaccine. Of the two, the measles is a much more dangerous viral illness, and we're going to get into that. Features that make the measles particularly bothersome. First, it's extremely contagious. If you take 10 individuals who have not been vaccinated, who have also not gotten the disease, and put them in a room with somebody who is contagious, in a few days, 9 out of 10 of those individuals will come down with the measles. It's also an airborne disease from droplets. But even going beyond airborne, it's actually what we call an air-space transmission. In other words, you don't have to be face-to-face with the infected individual. All they have to do is cough or sneeze, let's say, in an aisle in the supermarket. Those viral particles are going to circulate through the air for up to 2 hours. Some might land on a counter. They're still alive for 2 hours. The next person walks in. That sick person is long gone. They breathe in the viral particle, they get the measles. Or they touch the counter. They touch their fingers to their eye or their mouth, they get the measles. Another problem is the very long incubation phase where you're totally asymptomatic. Once you get the measles, those first 14 days, you don't have symptoms, yet the last part of that period, you're highly contagious and you don't even know it. And finally, its ability to run you down, allowing for secondary infections to occur, most commonly pneumonia. The measles has a very predictable course. Once you inhale the viral particle goes down to the epithelial cells of your trachea and bronchi. It gets into the cells, it starts reproducing itself. After a few days, it spreads to your lymphatics and to the blood, where it gets deposited into the lungs, the GI tract, and the brain. Next, you enter the prodrome phase. In the prodrome phase, you start to feel sick, and you develop FCCC, high fever, a cough, conjunctivitis or red eye, and Choryza, which is a fancy way of saying an upper respiratory infection with a stuffy, runny nose. In about 3 days, you're going to go into the enanthrum phase, which is a rash that develops inside of your mouth. This rash is what we call the sine qua non for the measles. It's called a carpalic spot. And if you look at it, it's going to look like little salt grains on the side of your mucosa just by the molars. You're the most infectious 4 days before this rash develops. This enanthrum phase with the carpalic spots is going to last a few days before you go into the exanthrum phase, where you develop a rash starting from the face and head and going down to the trunk, the arms, the abdomen, and then finally the legs. That's called a cephalocaudal spread. It starts from the top and it works down. And you're going to be infectious up to the last 4 days of that rash, which usually lasts 7 to 10 days. And then finally we get into the recovery phase, which is usually noted to have a pretty severe cough, and recovery could take up to 2 weeks. The problem is, this virus runs you down. So while your immune system is a bit suppressed, you always run the risk of developing secondary bacterial infections. And as I said earlier, the virus inhabits the lung, the GI tract, and the brain. Therefore, pneumonias, dehydration, and encephalitis, or a swelling of the brain, are the 3 most common causes for hospitalization. And that's the reason why 20% of patients that are infected with the measles end up in the hospital. There are several very common adverse outcomes that a measles infection can give. Of course, in the lung, you could wind up with viral or bacterial pneumonia. The GI tract might cause a profound diarrhea, leading to a profound dehydration, and in young children, that could be fatal. And finally, the brain. When talking about the encephalopathy, children under 2 are particularly sensitive to developing something called SSPE, subacute sclerosing panencephalitis. In other words, a swelling of the entire brain. And it could occur up to 14 years after they recover from the initial disease. And it's probably either due to a non-clearing of the virus or some kind of a genetic mutation. And it could present very subtly, a simple change in behavior, leading up to changes in consciousness, leading up to seizures, and unfortunately, it's quite often fatal. The best way to prevent getting the measles is simply getting the MMR vaccine. The MMR vaccine is given in 2 doses. The first dose is generally between 12 and 15 months of age. The second dose is just before you go to school, so it's usually between age 4 and 5. If they get just a single dose, they have a 93% immunity. And if they get the second dose, that jumps up to a 97% immunity. And that's very important. One of the problems with the measles is it has a very high requirement of immunity in order to have herd immunity for the community. In herd immunity, people being immune protect the non-immune. Now, in many cases, 80% of the community being immune will give you herd immunity. Not so much with the measles virus. Measles needs approximately a 95% community immunity to develop herd immunity. So it's really important to get the vaccines. Now, when a child is just born, if their mother has had the measles, they will get a maternal transfer of some immunity, but it only lasts for 9 months. So it's important that at that 12-month mark, they get their first vaccine. And the current vaccine is a live but attenuated virus. In other words, the vaccine contains the live virus, but it's been damaged in some way so that it cannot give you the measles, but it could protect you from getting the measles. Now, there's something important to know. That live attenuated vaccine started around 1967. If you got the original vaccine between 1964 and 1967, that vaccine was a heat-killed virus, and it didn't offer the immunity that the live attenuated does. So there is a potential for people that are around 65 years old to have lost their immunity. But it's a very simple blood test that could be done to see if you do have antibodies to the measles virus. And if you don't, you could simply get a booster shot. And the treatment for a measles infection is basically supportive. Get plenty of rest. Drink plenty of fluids to avoid dehydration. Take pain medication and analgesics for the fever, but not aspirin if it happens to be a teenager. They could develop a deadly syndrome known as Rye syndrome, so Tylenol for them. And sometimes vitamin A. That might help boost the immune response because vitamin A deficient people tend to be a little bit more susceptible to the measles. There are 2 groups, though, that are particularly important. The pregnant woman who gets the measles. If you get measles during pregnancy, you can get immunoglobulin therapy. And the people who are immunocompromised, such as HIV positive patients or patients with AIDS, they're not going to develop the signs that are mediated by the immune system, particularly the rash. So not only do they have the potential to walk around spreading it, not realizing they have the measles, but they're much, much more susceptible to development of a fatal pneumonia. I hope this answered a lot of questions about the measles, and now you understand that the measles and the German measles are two different things, that the measles can be fatal and is a very serious viral illness, and that the vaccine has a long track record of safety and efficacy against this measles virus. I hope you have a good day. Take care.